Hello, everyone. Good evening. Welcome to our Facebook Live on nursing prioritization and delegation tonight. So, thank you very much, everyone, for being here. It's another session again that we're going to have, and hopefully, all of you will be having a good time tonight and learn again from our session. So, for tonight, I have prepared very nice topics for all of you to learn. So, get ready, everybody. Participate in the comment section and also or in the chat box, and of course I will give you a shout out as well. Now, before anything else, thank you very much, Leanne. Also, before anything else, I would like to introduce myself. um, I am Mr. Alan Matus, and I am a nurse educator. I have been teaching students for almost more than 20 years. And I'm also currently a nursing faculty in a nursing program. And at the same time, I wrote a book. So the book that I published in Amazon is titled The Simple, Fast, and Easy NCLEX Review. So you can buy this book in Amazon. So currently it has 5-star rating. So a lot of students like the book. So if anybody has my book, can you please give a shout out if you like my book or not, everyone. But thank you very much for your purchase. And hopefully you like the book, guys. So you can get this from Amazon. And also, if you want to purchase this in the Philippines, just also send us an email, and we would be glad to give you instructions on how to purchase the book in the Philippines. All right. So another one, guys, I would like to share with you before anything else will be, of course, our testimonial. So our testimonial for tonight is coming from Christelle. And Christelle said, "Hello, everyone. I would like to thank Sir Alan Matus for helping me make one of my dreams come true to become a registered nurse here in the United States. I am a foreign graduate from the Philippines, and my husband introduced me to Sir Alan because he was also his former student and passed also his NCLEX as well. I was not too confident to take the exam, but with the help of Sir Alan, his lectures, his book, practice questions in the academy, and his words of support, I conquered my fear. It is very important to know the pathophysiology of the diseases so that no matter what the questions they throw on you, you can definitely answer it correctly." So Sir Alan explained it very well during his lectures. So thank you very much, Christelle, for that nice testimonial. Um, Also, everyone, I'll give a shout out to some people who just came in tonight. So the earliest people who came in tonight are the following. So thank you for being here. That will be the first one ever is Garcia Leanne. So thank you for being here. Talia L, Joyce Hamila Flores, Lizelle Gamboa Bantay, for Dr. Otello from Abu Dhabi. Then we have Lizelle Gamboa Bantay is from Ohio. So thank you very much for being here tonight. Um, Another one that I would like to share to everyone is our promo. So our promo is still continued until this time. Our April Fool's Day sale is extended until April 8, 2022. So you have until April 8 to get a 50% off our self-study comprehensive online NCLEX review course for 1 year. So there's going to be an online course, and you have the code that you can use during checkout. Then also our workbook is 30% off. Okay, 30% off. So instead of $99, it's only $69 right now. So that's our NCLEX Success workbook, everyone. Okay, so also 30% off. So grab that. Okay. Now, another one, we have of course, whenever you enroll online, you can have, or when you buy our workbook or you enroll in our live webinars, you're going to have the workbook. So this is how it looks like. You have your dream box, and then also it comes with your bookmark, and then of course other resources there. At this time, we have a promo. What you can do also is when you buy the workbook, you're going to get our special pen, a very nice pen that we're going to send with you at this time. So it's a limited time promo, guys. So get the workbook, and everybody likes the workbook, I guess. Another one, also, I have older adult sensitivity and empathy training. So, as what I have said last week, that our program or Matus Nursing Review is now a continuing education provider. So now we can provide training. So, our number one material that we're going to roll out is the older adult sensitivity and empathy training. So I'll be doing these trainings in nursing homes or skilled nursing facilities to train healthcare workers on how to become more empathetic and sensitive towards older adults, when they're taking care of them. So this is a very nice training. I really love this training when I used to work in a hospital. So now I'm rolling it out also to the nursing facilities as well. And then also, of course, for tonight, you're joining the session. You're gonna have a free 90-day online access NCLEX review. So we're gonna have our drawing at the end of the night, and let's see who will be the lucky winner for tonight, everyone. Okay. All right. So and then another one. Okay. So before anything else, I would like you all to share this session or subscribe if you're watching on YouTube so that others can also benefit, okay, from the program as well. Okay, thank you very much, LaShawn Taylor, for coming for joining us. You're from Los Angeles. Okay, all right. And then next also, okay, so we're ready for our first question for tonight, guys. So are you ready for the first question, everybody? Yes or no? So please click yes. We're gonna have your first question. We're gonna be focusing on one disease condition for tonight. Okay, so let's have the first question. It's gonna be on prioritization. So let's see. All right. So our question, everyone, is going to be about, okay, prioritization. So we have four patients, which you usually have in the NCLEX. So the first question that we have is, the nurse is caring for several clients in the labor and delivery unit. Which client requires priority intervention? A, the 21-year-old client in active labor who has 7 centimeters cervical dilation and contractions occurring every 3 minutes. B, the 19-year-old client with pre-eclampsia who complains of nausea and persistent epigastric pain. C, the 35-year-old client with early decelerations of fetal heart rate after rupture of membranes. D, the 26-year-old client who has bladder distension during the latent phase of labor. Okay, so again, which client requires priority intervention in this situation? So the nurse is caring for several clients in the labor and delivery units. So which client requires priority intervention? A, the 21-year-old client in active labor who has 7 centimeters cervical dilation and contractions occurring every 3 minutes. B, the 19-year-old client with pre-eclampsia who complains of nausea and persistent epigastric pain. Letter C, the 35-year-old client with early decelerations of fetal heart rate after rupture of membranes. Or letter D, that would be the 26-year-old client who has bladder distension during the latent phase of labor. Okay, so what do you think is the answer to this question? Which client comes first, okay, in the labor and delivery unit? A, B, C, or D? Okay, so I would like to give a shout out to some other people who just came in again tonight. So we have Sharon Paulo Alvarez, and thank you for sharing that with your group. Can you please let me know from which state are you coming from, everybody? Okay, from which state? All right, and how did you find out about Matus Nursing Review? How did you find out about our session, guys? Okay, so let's have the answer to the first question. Okay, Team Kaliao, thank you very much from Abu Dhabi. And Thali L, thank you very much for having my book. So the answer to this question, everyone. Okay. All right. So remember this question, everybody, labor and delivery unit. Now, which one do you think here is going to be a priority? Okay. So the answer, everyone, is going to be, let's see if you get it right. The first question for tonight is going to be letter B. So letter B is a 19-year-old client with preeclampsia complains of nausea and epigastric pain. Now, why is letter B the answer, everyone? Letter B is the answer because this preeclampsia, you all know the signs and symptoms of preeclampsia, right? But the patient with preeclampsia who has nausea, especially the word persistent epigastric pain, what's the danger of that? What's the danger when the patient has preeclampsia? Preeclampsia leads to what? What is the possible problem when you have preeclampsia? Preeclampsia leads to what problem, everyone? Preeclampsia leads to eclampsia, which is your convulsion or your seizure. So persistent epigastric pain may be a sign that your patient is going to have eclampsia or seizure. So you have to prepare. Okay, you have to prepare for seizure precautions because letter B have persistent epigastric pain. So usually epigastric pain is usually occurs before a possible convulsion or eclampsia, everyone. Now your letter A, of course, that's active labor, 7 centimeters is expected. At the same time, every 3 minutes is within the range. So that's considered to be normal, guys. Okay. Now your letter C, the 35-year-old client with early decelerations of fetal heart rate after rupture of membranes. Remember that early decelerations are considered to be normal, normal fetal heart rate tracings. Now, the abnormal heart rate tracings will be your late decelerations and your variable decelerations. So these fetal heart rate tracings are something that I discuss when I go over this one by one when we go to maternity nursing. Okay. Now, letter D is bladder distension. Letter D actually is also a priority. Why? Because in the latent phase, if there's bladder distension, we all know that bladder distension can impede or inhibit the uterine contractions. So that's why letter D could be also a priority. However, letter B comes first because you're talking about safety there, you're talking about your convulsion. So that's why letter B is the answer, guys. Okay. So moving further to that, just remember that those are the that's the answer, everyone. Okay. So are you ready for the next question, everyone? Okay. So let's have the next question. Okay, so from Jeddah, Saudi Arabia, and following me on YouTube. Thank you very much, Sharon Paulo Alvarez. Okay, so a 34-year-old client is diagnosed with preeclampsia, which assessment findings will be present. So like all that apply: A, hypertension; B, severe headache; C, polyuria; D, swelling of the limbs; and E, vomiting as well. Again, so a 34-year-old client is diagnosed with preeclampsia, which assessment findings will be present. So like all that apply: A, hypertension; B, severe headache; C, polyuria; D, swelling of the limbs; or E, vomiting. So what are the signs and symptoms of preeclampsia? Thank you, Mary Princess Canaveral, for sharing the session for tonight. Okay, and Kumar PHS is from Arizona. Okay, and then we also have so MJ, don't change your answers next time. Okay, just stick to your answer. Then we also have, okay, hi Jasmine, nice to see you here. That's my student in the online class for today's lecture, Tuesday. Benedicta Intisiagwe, thank you. Nice, Benedicta. Thank you for being here tonight, Benedicta. Okay. So what's your answer, everyone? Put your answers now so that we will find out. Okay. What's the final answer? What are the signs of preeclampsia? Okay. What are the signs of preeclampsia? Okay. Let me see. All right. So from Jennifer Aguilar is from Hawaii. All right. So what's the answer to this question, everyone? Okay. Always remember that preeclampsia is a major topic in the NCLEX, and we need to know the signs and symptoms of this condition, especially the ones that stand out. Okay. The answer, everyone, is going to be, all right. So that's it. You have your A, hypertension; B, severe headache; D, swelling of the limbs; and then letter E, that will be your vomiting. So don't forget your letter B, guys. Severe headache is really one of the manifestations of your preeclampsia. Remember that, preeclampsia. Swelling or edema, vomiting. Now, what are the other signs of preeclampsia? So polyuria, does that happen? Polyuria, no, it's actually going to be decreased urine output or oliguria. Okay, so these are the signs of preeclampsia. You have rapid weight gain, abdominal pain, severe headaches, reduced or no urine output, excessive vomiting and nausea, vision changes, swelling of the hands and the feet, decreased urine output, and shortness of breath. And don't forget also the presence of albumin in the urine or proteinuria. So that would also be found. So especially your hypertension, you have your hypertension, you have your hypertension, edema, and also your swelling or and also your proteinuria as well. So don't forget all those signs and symptoms, guys. All right. So if you understood those, if you understood my explanation, so say yes in the chat box, everybody. Okay. So don't forget that. So are you ready, everyone, for the next question? Okay. So our next question is going to be the following. Okay, let's see. All right, so that's the next question. A client with preeclampsia, so it's all about preeclampsia tonight, guys, receives intravenous magnesium sulfate to prevent seizures. Which nursing action is most important when giving this medication? A, monitor the urine output. B, place the client aside lying position. C, encourage fluid intake. Or D, ensure bed rest. Next, number 3. So this is still prioritization in nursing actions. A client with preeclampsia receives intravenous magnesium sulfate to prevent seizures. Which nursing action is most important when giving this medication? A, monitor the urine output. B, place the client on side-lying position. C, encourage fluid intake. Or D, encourage bed rest. So put your answers, everyone. Elsie Olaco is watching. Currens Gonzalez, thanks for being here. Joem, okay. All right, so we have Iano Nimes, okay. Annie Turbio, hi Annie, you're here. I know Annie is already a pastor, but she's joining us tonight. Okay, LaShawn Taylor. So, everyone, what do you think is your priority? A, B, C, or D? Okay, when giving your magnesium sulfate, what is the most important consideration? Is it fluid intake? Is it monitoring the urine output? Is it encourage fluid intake? All right. So let's see. I think most of you, let's see if you got the right answer, everyone. Okay. Magnesium sulfate, the answer, everyone, is going to be, all right. So the answer is going to be letter A. Very good, guys. Monitor the urine output. Okay. Monitor the urine output. Very good, guys. Okay. So monitor the urine output. Okay, so it's not placing the client on the sideline position, encourage fluid intake, no, or ensuring bed rest. So the 3 R's of magnesium sulfate toxicity, the ones that stand out. So remember, renal output is decreased, so will be R. Okay, so oliguria. Next, you have to monitor the respiration, which is less than 12. You have to report. And then the last R is deep tendon reflexes, which includes your biceps reflexes or your patella reflexes too. So BP low, urine output low, very good. Because magnesium sulfate, if you can remember, everyone, magnesium sulfate is a CNS depressant. And magnesium sulfate is being given in preeclampsia to prevent your convulsions or your eclampsia. At the same time, your magnesium sulfate is a tocolytic medication. When you say tocolytic medication, meaning it inhibits uterine contractions as well. Okay? And don't forget, everyone, can you write down in the chat box, in the comment section, what's the normal level of your magnesium sulfate when given to a patient with preeclampsia? What's the normal therapeutic range for magnesium sulfate? And another in the comment section, write down what is the antidote for magnesium sulfate toxicity. What is the antidote for magnesium sulfate toxicity? So can anyone answer those 2 questions? Okay. And the 2 questions will be, what's the normal therapeutic value for your magnesium sulfate? And number 2 will be, what's the antidote for magnesium sulfate toxicity? Okay, so take note of those, guys. All right, so let's see if we have the answer in a moment. I will be looking at that. Now, before anything else, to the next question, I want to share our announcement for our next class. This will be on April 16. We're still accepting enrollments right now for our 10-day live comprehensive NCLEX review webinar. So it's an interactive online NCLEX review to master your nursing core content. So that will be every Saturday from April 16 to June 18, 2022. Every Saturday from 8 to 4:30 p.m. So just visit our website, matusnursingreview.com, and then click online review class, and we'll also share the link in the chat box as well. So the normal therapeutic range for your magnesium sulfate is going to be from 4 to 8, 4 to 8 milliequivalents per liter. So 4 to 8. And your antidote, that's correct, that's going to be your calcium gluconate. Calcium gluconate. So our desired therapeutic range for magnesium sulfate when given to a woman to a female client with preeclampsia is going to be 4 to 8. Okay, so somewhere around that range, guys. Now, so don't forget our NCLEX review. Let's go to our next question. Are you all ready, everybody? Our next question. Our next question will be on delegation. Okay, not delegation, but another question. Okay, so let's see. The nurse cares for a client with preeclampsia. Which of the following findings best indicates the presence of HELLP syndrome? I'm not sure if you've heard about HELLP syndrome, but okay. HELLP syndrome, that would be A, hypotension, B, rashes, C, right upper abdominal pain, or D, joint pains. Okay. So the nurse cares for a client with preeclampsia. Which of the following findings best indicates the presence of HELLP syndrome? HELLP syndrome: A, hypotension, B, rashes. Then you also have right upper abdominal pain and joint pains also. Okay, so put your answers, everyone. Put your answers, everybody. Okay. So the normal therapeutic range is going to be 4 to 8 milligrams per deciliter. Are you giving me a different range also there? I think that's a different unit, the one that you're giving me. I think it's mmol, but in milligrams per deciliter, the therapeutic index is the therapeutic level is 4 to 8. Okay, so let's see if we have other students who joined us tonight. Okay, so we have other students. Okay, so the answer, everyone, is going to be let's see, some answered letter D, some answered letter A. So what is the meaning of HELLP syndrome first? HELLP syndrome is a complication of pre-eclampsia. Okay, it's a complication. All right, so the answer, everyone, is going to be, let's see. Okay, so that will be letter C, everyone, right upper abdominal pain. Okay, so that's the primary manifestation of your HELLP syndrome. And I think this is one of the best manifestations, your right upper quadrant pain. So HELLP syndrome means your hemolysis, elevated liver enzymes, and low platelet syndrome. It is a life-threatening pregnancy complication, usually considered to be a variant of preeclampsia. So both conditions usually occur during the later stages of pregnancy or soon after childbirth. So preeclampsia can lead to HELLP syndrome, so meaning affecting the liver, and then also you have low platelets. So your liver enzymes means your AST and your ALT. Those are your liver enzymes. Now let's try to learn also about the signs and symptoms of HELLP syndrome. For HELLP syndrome, you have epigastric or substernal chest pain, including abdominal or chest tenderness and upper right-sided pain from liver distension. You have nausea, vomiting, or indigestion, a headache that won't go away even after taking medications such as acetaminophen. Now, shoulder pain or pain when breathing deeply, You also have bleeding, changes in vision like your blurred vision, seeing double or flashing lights or auras. Then also you have swelling, especially on the face and the hands. And lastly, you have your shortness of breath as well. So shortness of breath. So these are the signs and symptoms of HELLP syndrome, everybody. Okay? So hopefully you learned something about the complication of pre-eclampsia, which is your HELLP syndrome. All right. So next, okay, so let's have the next one. Okay, so our last question for tonight is going to be on delegation. It's going to be on delegation. So everybody, please, please say yes in the comment section if you're ready for our last question for tonight, guys. Delegation. So let's check, okay, if you're good with delegation. So which of the following tasks can the registered nurse or RN delegate to the licensed practical nurse or LPN while caring for a client with severe preeclampsia? Select all that apply. Okay. Which of the following tasks can the registered nurse or RN delegate to the licensed practical nurse while caring for a client with severe preeclampsia? Select all that apply. A. Administer oral beta blockers. B. Provide adequate fluids. C. Infuse magnesium sulfate. D. Place the client on left side lying position. Or E. Evaluate renal function. Or F. Assess for HELLP syndrome. Okay? So what will be the answer? Select all that apply. So don't forget to study your preeclampsia and your eclampsia and also your pregnancy-induced hypertension, okay? Because you can like, these are major topics in your NCLEX, your hypertensive disorders of pregnancy, your preeclampsia, eclampsia, magnesium sulfate, your calcium gluconate as the antidote, the therapeutic level of magnesium sulfate, HELLP syndrome, the signs of magnesium sulfate toxicity, especially how do you check the deep tendon reflexes? You know, what are those deep tendon reflexes that we check and they're absent or decreased? Monitoring the urine output as well. What are the warning signs of a convulsion, you know, of the eclampsia that it's about to happen? All right. So study those. And of course, the signs and symptoms of preeclampsia, you need to master them definitely. Okay, it seems like you have the answers, everyone. Finalize your answers, everybody. Okay, finalize your answers. Now, I'm going to ask everyone, can you put in the chat box, what is the only cure for preeclampsia? What is the only cure for preeclampsia? What is the one and only cure for preeclampsia, everyone, or the best management for preeclampsia? It's not magnesium sulfate. What's the only cure for preeclampsia? Can somebody put that in the comment section? So finalize your answers. Some of you answered A, B, and D. Okay. So let's see if you got the right answer, guys. So we have Iano Neems. She mentioned delivery. You're exactly correct. You know, the delivery is the only option. Okay, the cure for preeclampsia. Very good. Okay, so let's see what's the answer for this question, guys. Or you can have cesarean delivery. Yes, of course, that's going to be the option. Okay, to induce labor and of course to deliver the baby. Cesarean delivery, definitely. If you want to watch or really know more about preeclampsia, I remember there's this very nice clip from the TV series, The Downton Abbey. So you can watch the episode there with Sybil. You know, she has preeclampsia and she actually died because of eclampsia, preeclampsia and eclampsia. So she had convulsions. So you can watch the clip in that TV series. Okay, so let's see, guys. The answer is going to be, let's see. The answer will be letter. Okay, so the answer is going to be letter A, B, and D. Very good, guys. Okay, A, B, and D. So LPNs or licensed practical nurses can answer or can um, administer oral beta blockers, of course, provide adequate fluids, and place client on left sideline position. Infusing magnesium sulfate is RN because that's intravenous. Evaluating renal function, that's evaluate, that's for the RN. So RNs do not delegate anything with evaluation. And assessment for complications like HELLP syndrome, that would be specific for the RN, especially complication assessment. Now, we said time and time again in this in this we said time and time again in this Facebook Live that can LPNs assess? Yes, LPNs can assess, but again, LPNs can only do focused assessment or specific assessments. So LPNs can check bowel sounds, they can check the color of the stool, they can check the heart rate, but in terms of comprehensive or complex assessment, it has to be the RN. Okay, so assessment by the RN, especially for initial or complete or admission assessments, everyone. Okay, so thank you very much, Annie. Thank you for sharing also your story there a little bit. Okay, so I hope you learned something tonight, everyone. And before anything else, I would like to plug in our Matus Nursing Review Online NCLEX Academy. So these are all the features of our self-study program. At the same time, our live webinar. So a lot of our students, or most of our students, or all of our students will have access to the online NCLEX Academy with all of this recorded lectures. We have our workbook that you can buy, study plan checklist, NCLEX quizzes, predictor assessments, and of course everything that we have recorded here. So guys, can you please put in the chat box what are the best things that you learned tonight? What stood out for you guys? What did you like about our discussion for tonight? What were some of the items that you learned? So of course, this is our merchandise products, guys. Okay, so if you want to buy our shirt, we have this on the website as well. And our winner for last week was Rich John Hanan Ricardo. So give him congratulations, everyone, for winning our 90-day online access academy, like raffle or drawing. So thank you very much, everyone, for tonight, and I hope that you share this, and I hope that you learned something, guys. Thank you very much for all the comments that you're putting in the chat box, and I really like the fact that you're here, everyone. So next week again, it's gonna be Tuesday again. Wait for announcement in our Facebook page, everybody. Thank you very much, everyone, and have a good night, everybody.